Okay, so we're on day 2 now of our Fluoxetine dose. So I thought I would let you know what Fluoxetine actually is. I have the little paper manual. So basically, we'll go through it, see what it says, and see if it can help us out. Maybe me, maybe you. Let's find out. Fluoxetine treats depression and anxiety or disorders. Like all medicines, it can have unwanted effects. It is therefore important that you and your doctor weigh up the benefits of treatment against the possible unwanted effects before starting treatment. Obviously, you're not necessarily going to know the side effects when you walk in there and you get presented this. So you're not necessarily going to know the effects of the tablets when you get them. But obviously, checking this out, as I have done before, is a good way to start. Just in case there is something that does put you quite off them. Two notes to basically start you off on the Fluoxetine. Obviously, like I said, the Fluoxetine won't work straight away. Some people taking antidepressants feel worse before feeling better. Your doctor should ask to see you again a couple of weeks after your first treatment. Tell your doctor if you haven't started feeling better. So obviously, then that's for you and the doctor then to discuss. In terms of like upping the dose or something like that. So obviously it all depends on how you feel. But of course, some people who are depressed or anxious think of harming or killing themselves. If you start to feel worse or you think about harming or killing yourself, see your doctor or go to a hospital straight away. Yeah, I would say that is quite important. If you are having those feelings anyway, I know it's really hard to like talk about that. But if tablets or anything like that is making you feel as if that is the way to go, then please talk to someone, because nobody. It's a long term answer to a short term problem. So don't feel that you need to take that matter into your own hands. Talk to someone, whether it is a friend, a family, uh, a relative, or it's your GP, or it is just someone in a hospital, or someone on the phone, like Samaritans or something like that. Because I've had that. It's fucking terrible. Seriously, I know how hard it is. Okay, so possible side effects of Fluoxetine. Basically, they do range from very common, common, uncommon, and rare. So, we'll have a look at a couple of the. There's only like four very common ones, which is insomnia, headache, diarrhea, or fatigue. Uh, they they say they infect more than 1 in 10 people. So, right now I have two of them. Take a guess which ones. Let's not make a game of it. Nobody wants to make a game of this, believe me. Common. So we got may affect up to 1 in 10 people. So we got things like not feeling hungry, nervousness, restlessness, feeling tense, decreased sex drive, sleep problems, unusual dreams. I had them a lot the first time I went on meds because of the meds themselves, and that range from like sleep paralysis, that was really weird, messed up dreams, and you wake up and that's it. You cannot get back to sleep. It's awful. The uncommon ones, they say up to may affect up to 1 in 100 people. So that's feeling detached from yourself, strange thinking, abnormally high mood, orgasm problems, teeth grinding, muscle twitching, which I actually think about it. I actually had muscle twitching in my finger last night. That was weird. Enlarged pupils, coordination problems, shortness of breath, hair loss, cold sweat, difficulty passing urine. Yeah, there's loads of this type of stuff that after about a week you may start to notice. I mean, this has been about 2 days now, and I've already started to notice things. So rare, which is one up to 1 in 1,000 people. So we have things like hallucinations, agitation, aggression problems, stuttering. I stutter like a bugger anyway, so I'm okay. Muscle pain, panic attacks, sensitivity to sunlight. I'm just a gamer, so I have that anyway. And producing breast milk. I'm going to say no on that one, but okay. Obviously, if you are experiencing any like the really bad side effects, then go to your doctor or go to the hospital to get that advice, to get that change, because obviously some things like insomnia and having headaches, they will pass with time. They are quite normal, but then if you are getting lung problems and breathing problems and things like that, that is something that you need to get sorted as soon as you can, as opposed to just seeing what happens. So obviously, letting your doctor know about that as soon as you can. That's the best for everyone there. And I think, needless to say as well, if you miss a tablet, don't double dose the next day or anything like that. Just go back onto it as you would normally. Just take it one per day, because that's just asking to take more problems, and it could lead to like an overdose situation. So like most medication, then it is just a case of taking the time to go through the. I'm going to say leaflet because it is bloody huge, and you just make sure that you're comfortable with what you're taking, that you and your doctor have agreed upon, and you know just keep being safe, and just let yourself know that there is always people to talk to out there, even if it's a case of just finding me on Twitter or something and just saying, can I talk to you? I may not necessarily be there straight away, but my phone is never normally that far away from me. So, until next time, stay safe and keep watching the skies. Yeah, I don't know where the hell that came from. So until next time, stay safe and hope you're all feeling better soon.